All right, everybody, welcome to this webinar today. Welcome to everybody who's here in person and those who will be listening to the recording afterwards. As you see, we are recording this session and it will be available on the CANE website for anybody who wasn't able to attend in person today. So welcome to our webinar on Radon education, the Radon education initiatives for perinatal families, which we are presenting in association with Health Canada and the Canadian Association of Nurses for the Environment. My name is Fiona Hanley. I'm a course lecturer at McGill University School of Nursing, and I'm the co-chair of the CANE Education Committee. If you have any questions or comments, I do invite you to put them in the chat. And we can address them at the end. And I will start by introducing our speakers for today. We're going to start with Kelly Bush, who's the National Radon Awareness Program Manager for the Radon Protection Bureau with Health Canada. And then we're going to hear from Casey Knowles, who is a pediatric nurse in British Columbia and project coordinator for radon awareness at CANE. I'd also like to acknowledge Jack Avanti-Struss, who's professor at University of St. Boniface, Winnipeg, and past president of CANE, and they are the project lead on the development of the radon assessment tool and online learning modules that we will be introducing you to today. And also just to recognize Blandine Kama and Hajar Oudbi of the University of St. Boniface, who presented in the French version of this webinar. And also Fred Joubinville, who is a professor of communication and multimedia at the University of St. Boniface, who at the end of Kelly and Casey's presentations is going to go through the module a little bit and just do a little demonstration of how it works. So I'm going to hand it over to you, Kelly, and hope that the screen sharing will go okay. And we'll just give you a minute just to get that started. Great, we can see very well. Thank you very much. So over to you, Kelly.
Great. I thought I was on mute and I was trying to find the button, but I'm not. So it's perfect. So you can see the slides, no problem?
We can hear you very well. Thanks.
Okay, wonderful. Well, good afternoon or good morning, everyone. Thank you for taking some time today to learn about radon. So I am with Health Canada's Radiation Protection Bureau, and I'm the manager of the National Radon Outreach and Stakeholder Engagement Program. And I'm happy to be here today to give you some basic background information on radon, what it is, and how it can affect your health and what you can do to reduce the risks. Comme mentionné, si jamais il y a des personnes qui préfèrent de demander des questions en français, I'd be happy to answer dans votre langue de choix. And I would like to begin just by recognizing that I am currently presenting from Ottawa, Ontario, the unceded, unsurrendered territory of the Anishinaabe Algonquin Nation. So let's start with the basics. What is radon? It is a radioactive gas that is produced by the breakdown of uranium in soil and rock in the ground. And when radon gas is released from the ground into the outdoor air, it gets diluted and it's not a concern. But in enclosed spaces like our homes, it can accumulate to high levels and become a risk to the health of you and your family and your patients. You cannot see or smell radon gas. It's invisible to the senses. The Canadian guideline for radon is 200 becquerels per cubic meter. So you want to measure the radon level in your home to make sure you're below that level. All homes, this is really important to understand. It's never a question of whether or not you have radon in your home or in your building, where you work, where your kids go to school. Every building in contact with the ground has some level of radon in it. The question is how much, and the only way to know that is to test. And so importantly, if the radon level is high, it can be fixed, because a lot of people hear about radon and they don't want to deal with it because they figure there's nothing they can do about it, or whatever they have to do about it is exorbitantly expensive or too difficult. And that's absolutely not the case. So I like to start just to speak a little bit about how we are exposed to radiation in our lifetime, and sort of where radon sits in that exposure. So there's 4 major sources of public exposure to natural radiation. There is cosmic, terrestrial, inhalation, and ingestion. And there are also 4 categories of artificial or man-made sources of radiation. And those are atmospheric testing, like, for example, of atomic weapons, medical sources like X-rays and CTs, industrial sources, smoke detectors and glow-in-the-dark exit signs, believe it or not, have some radiation in them. And then a nuclear fuel cycle or power plants. So of all of those different sources, it's estimated that radon exposure represents almost 50% of a person's lifetime radiation exposure. This is why it's really important to know about radon and to take action to reduce your exposure to it. And it's why Health Canada has a national radon program in place. So what you see on the screen now is a radon risk map of Canada. This is the most recent Cross-Canada Radon report that was released just in October of this year. And it estimates that 1 in 5 homes have high radon levels, and that radon levels are higher in rural versus urban areas. But it's important to understand that radon levels vary across the country. I get this question often, like, what's the level in my area? Whether you live in an area, I can tell you, whether I can tell you live in an area that's low or high, or your neighbor tested and they found low or high levels, you cannot use that to predict or know what the radon level is in your own home. You can have next door neighbors that have very high levels and you can have low levels. The only way to know is to test. So radon can be found in every building that's in contact with the ground. And for this reason, we wanted to get a better understanding of the risk assessment for radon exposure in various indoor environments. And so we had one of our senior researchers, Dr. Jing Chen, did some research on this and released a publication. And what it looked at radon survey data from workplaces, schools, and homes, and found that on average, radon concentrations in Canadian homes are about 3 times higher than in schools and almost 5 times higher than in public buildings and indoor workplaces. In addition, Canadian statistics show that most Canadians spend about 70% of their time indoors at home, about 20% indoors away from home, and sadly, only 10% outside. So due to the relatively higher levels of radon found in homes, as well as longer time spent in our homes, the exposure at home, we estimate, contributes to about 90% of our radon-induced lung cancer risk. So very important to test homes, but still need to be testing our schools, workplaces, daycares, et cetera. So how does radon get into our homes and buildings? So there's several factors that influence the amount of radon that moves from the ground into the home. First, the amount of uranium in the ground surrounding your home, the construction type, foundation condition, occupant lifestyle. So that meaning how many doors and windows you open. And finally, the weather, the temperature, winds, and rainfall all can also influence how much radon gets into your home. And also, because radon is a gas, it can move quite easily from the ground into our homes through any small opening it can find, such as cracks and gaps in the home's foundation floor and walls, around pipes in the floor wall joint. You can see in the image all of the different ways on the slide, all the different ways that radon can easily move from the ground into a building and into our homes. And then once in our homes, it can build up to dangerous levels, which is why you want to measure it. And so what's the health risk? The health risk from radon is long-term and depends on 3 things: how high the radon level is, how long you're exposed to it, and whether or not you are a smoker. Radon is recognized by international authorities and experts as the leading cause of lung cancer in non-smokers. Smokers also exposed to radon have a significantly increased risk of lung cancer. So Health Canada, based on the research that we have, we estimate that more than 3,000 lung cancer deaths a year are radon-induced. That's equivalent to more than 8 people a day. Radon is a very significant but preventable health risk. And the other thing I think is important to mention is lung cancer is the most common cancer in Canada, and the survival rate is really low. I think we all know that. It's too often it's diagnosed late. So testing and reducing your radon exposure is the best way to reduce your risk of lung cancer if you don't smoke. And most recent estimates are that about 30% of lung cancer deaths in Canada are non-smokers. So how do you test? Because I mentioned a couple times you have to test. It's really important. So we recommend that all homes and buildings should be tested. And it's quite simple. You have 2 options. You can purchase a do-it-yourself test kit, or you can hire a certified radon measurement professional. Whatever option you choose, you need to do a long-term test for a minimum of 3 months, ideally during the fall or winter time when your windows and doors are mostly closed. Long-term testing is really important because radon levels can vary quite significantly over time. And you want to be able to compare your annual average exposure to our guideline level to make a decision as to whether or not you need to take action. And a 3-month test or more can estimate that annual average for you. So as you can see on the image of the slide, if you're tempted to do a short-term test, because they do exist, it's much more likely to lead to a false negative or false positive. So take the time and do the long-term test. And to find a certified radon test kit or a measurement professional, you can simply go to takeactiononradon.ca. All of the test kits and professionals listed there are certified, so you can trust the resources that you're getting. And I mentioned earlier, it's so important to know that you can reduce the level. So how do you do that? Techniques to lower radon levels are very effective and can save lives. Radon levels in most homes can be reduced by more than 90%, and a radon mitigation system can typically be installed in less than a day or a day or two. Health Canada recommends that you hire a radon mitigation professional that has been certified under the Canadian National Radon Proficiency Program, and you can see their logo on the slide, CNRPP. They can help you find the best way to reduce the radon level in your home. The most effective and the most common radon reduction method is called active soil depressurization. This method involves installing a pipe through the foundation floor that leads outside of the house, either at ground level or roof line.
Don't worry, Kelly, just take your time. We'll just wait.
I can feel that coming on. I'll try to get to the end because this is the last slide. Excuse me, it's just a tickle.
That happens, don't worry.
Yeah. So the active soil pressurization system has a pipe, like in the image you can see, that goes through the foundation floor and it leads outside, either ground level or roof line, with a small fan attached. I'm not crying. What that system does is draws the radon and soil gas from under your home and puts it back outside before it gets into the house. And outside, the radon level gets quickly the radon gets quickly diluted by mixing with outdoor air. So that is my last slide that covers all the basics of radon. I'd be happy to answer any questions, maybe in a couple minutes, so I can get this little tickle under control.
Don't worry, Kelly. Thanks very
Yeah,
much.
thanks for your time.
So I don't know if anybody has any immediate questions at the moment or would like to put them in the chat. And if not, we can go on to, Amy has raised her hand. Amy, I don't know if you're, Jack, maybe you can allow Amy to speak.
I just wanted to let you guys know the chat is disabled, so we wouldn't be able to put anything in it.
Oh,
Yeah, so you guys, if you have questions, there's a Q&A function on the bottom that you guys can write your questions in if like you don't want to interrupt and you want us to answer them at the end. But thank you, Amy.
sorry, I didn't realize that. Amy, thank you very much for letting us know. So for sure in the Q&A, yes, if anybody has a question. But also, if anybody has an immediate question for Kelly, then feel free at the moment. There is actually a question, Kelly. Is there a cost for the testing kit? Maxine wants to know.
Yeah, great question. Yes, sorry. Testing kits typically cost between $50 and $60. And a mitigation system, if it needs to be installed, is typically between $2,000 and $4,000. There are grant programs and funding programs available for low and medium income Canadians who need to install mitigation systems. So certainly they can reach out to us, and I believe the CANE leads that lead this program also have this information. It's a mitigation grant that's available through the Canadian Lung Association. So there are ways to help with that cost.
Yeah, thank you, Maxine. That is a great question. And yeah, I think some of that will be some of that information is in the tool that we're going to talk about shortly as well too. So unless there's any other burning questions for right now, we'll pass on to Casey's presentation then. Casey, if you're able to share your screen.
Yes. Hi, everyone. Thank you for coming. Thank you, Kelly, for such a wonderful introduction to radon. Having that foundation knowledge is going to be really helpful moving through into the next two presentations I have for you. Last year, around this time, we launched our radon assessment tool, which actually is standardized to test or to assess for radon risk, specifically for the perinatal population. So it was I can get a little bit into it here if we want to start the slides. And all this was funded by Health Canada, which is wonderful. So when they came to us with the issue of radon, they wanted to know how best to not only educate the population and that perinatal population that is so difficult to reach, but how can we prevent exposure? So with this in mind, our objective was to create an educational tool that can be used in person or at a distance and can be adaptable for equal access across all social determinants of health, and to have an educational tool that encompasses both screening, brief intervention, and provides solution recommendations at the same time in order to reduce health-related anxiety regarding exposure risks, which is extremely important when dealing with this population. So why perinatal? Children are estimated to receive higher doses of radon relative to their size and the shape of their lungs, and the fact that they have a faster respiration rate than adults. Children also have much longer to live than adults, thus lengthening their exposure. Expectant parents are notably more highly motivated to prepare for their newborn and take the preventative measures throughout their pregnancies and in early childhood, increasing the likelihood of not only conducting that testing in their home, but taking action to remove the risk. Since we learned from Kelly, radon is a long-term exposure risk, our goal is to prevent children from being exposed altogether. So when conducting the literature review, we found that in order to reach the perinatal demographic, early intervention is very essential. So introducing education during the pregnancy planning, preconception, all the way through until discharge and after birth. Since radon testing takes time, it's best to provide this education while parents are making other important health decisions regarding their pregnancy, adoption, or any other methods families may take to having children, and then allowing for that follow-up care. Providing education to the perinatal demographic allows for ongoing teaching throughout the pregnancy, and then action being taken, such as home testing, reviewing results, and accessing resources needed before the child arrives. I think I just saw in the comment that we want to go full screen. Fred, are you able to full screen the presentation for me, please? There's a button right to the right of where you are. The two arrows on the bottom right-hand corner. There we go. Perfect. Thank you. Great. So when speaking about this early intervention in the literature review, we understand that this is idealistic. In many cases, it might not be possible to target families in their early pregnancy and have follow-up care. But what's nice about this radon assessment tool is we truly accommodate for many different situations. So it is adaptable for different families and where they're at. Another key finding in the literature review is that healthcare providers or practitioners are much less likely to conduct assessments and provide education on topics they are not confident in their knowledge of. And I know, like myself and many other healthcare practitioners, they may not have heard much about radon or feel comfortable talking to their patients about it. Especially in the perinatal population, there is high anxiety from parents about the health and safety of their children. So it can feel like a huge weight to take on as a healthcare practitioner to begin that education. And I'll get into that a little bit later about how we can prepare for that as healthcare practitioners. All right, so the next slide. Initially, our question was, or our goal was, a tool designed by nurses for nurses. And that was because nurses facilitate conversations about health, they minimize health anxiety, and help translate scientific knowledge to everyday knowledge as a daily part of our job. And research is showing that nurses are becoming leaders in planetary health initiatives. But in this process of about almost 3 years now working with Health Canada, our goal has switched from nursing to encompassing all different kinds of healthcare practitioners and providers of many different backgrounds, specialties, and education. And I'm also excited to talk a little bit more about that when I introduce our learning module in the next presentation here for you. So next into the Radon screening tool creation. When designing this, as I said, we wanted it to be very accessible. So the tool is online and it is mobile friendly. It can be accessed through a QR code or on the CANE website. Even if you Google Radon assessment tool, it will be the first thing that you pop up. And while the goal is for a healthcare provider or practitioner to go over this with the patient, we've made it so it is a 6th grade reading level. It has many different language abilities and different features to help with that equal access, because we understand not everyone has immediate access to a healthcare practitioner or provider, and they still want access to the information. When answers are submitted, a document with a specified brief intervention will be provided, and that can also be downloaded as a PDF. For those that are not tech savvy or own a device, paper copies will be accessible at healthcare practitioner clinics across the country. And I will actually show you an example of that very shortly. But our goal when creating this was really reducing barriers to accessing healthcare information and healthcare knowledge to make informed decisions. All right, so in terms of validation, we had sent feedback forms to both healthcare providers and nurses, as well as perinatal families, and got their feedback, and actually incorporated a lot of their feedback into what is now the finalized tool. We're still taking feedback every day though, so if you want to reach out, you're using this in practice, you can contact us on the CANE website and give us your feedback, and we are still updating our tool to make it as easy as possible for everyone to use. Now, in terms of QR codes, I did mention that you can use QR codes, and one of the great things is we have created posters on the next slide that everyone can scan on their phones, and it's going to take you directly to the Radon assessment tool. Now, I'm going to very quickly kind of show you the tool. It's very short and easy to conduct. If you want to go over it with me, you can scan that QR code, and we're just going to pull up, Fred, if you're able to pull up our Radon assessment tool, I'm going to show you some of the cool features we have for accessibility that I mentioned. Bottom right corner, the very bottom right, there you go. So as you can see, if you just Google Radon assessment tool, or go to our CANE website. Great, thank you for showing us how to access it. Perfect, so this is a Radon assessment tool. And so you'll notice that there are highlighted words. These words are part of our accessibility, where if you hover over the word, it will give you a definition or another term for that word. And those are ones that may be over a 6th grade reading level, or may just be harder to have an understanding of. So if we quickly go through, you'll see an example of the questions. So we're going to get an example of our brief intervention. And so a lot of these questions are referring to the education that Kelly gave us regarding radon. So it's all these risks to radon. Are you living on the lower level of a home? Do you have kids? Are you smoking inside? What is your ventilation like? And then we also wanted to include people who rent their home and don't own, because again, we're going for that accessibility. And we also, as Kelly mentioned, financial circumstances. We want people who are concerned about financial circumstances to be able to still utilize this tool and access these services for radon removal and intervention. So that is there as well, which provides links to different funding across the country, depending on where you're living. And then once we finish this is an example of the brief intervention that you receive. And it can be downloadable, and this way all your information is in one place. You aren't having to scroll through the internet. You're not having to go up against all this misinformation. All the Health Canada recommended information is right here all on one page, and it's specific to you and your family. Great, thank you so much, Fred. Now, what's really exciting is, as I mentioned earlier, in the preliminary literature review we did was that healthcare practitioners are unlikely to provide education or assessments on a topic they don't feel comfortable in. And this has led to what we now have, and we are launching, I believe, at the end of this month, so very, very shortly, which is our Radon learning module, also paired with Health Canada. So we've been doing this work together for a few years now, and we are very excited to share this educational module for healthcare providers. And we can move to the next slide. I want to introduce you to a friend, Sophia. You're going to hear them share their story, and I'm going to let them kind of introduce themselves. But this, unfortunately, is not a unique story across Canada. And this video is how our learning modules start off. So this will be the first thing that you see. So I'll just give Sophia a moment to tell her story.
We don't have the sound of Sophia. I don't know whether we can fix that, Fred. Sorry, everybody. Wouldn't be a webinar if there weren't at least a hitch or two, technical hitch or two.
I was asked to talk about
Great, thank you.
radon and my experience about radon. My mom was diagnosed in 2009 with lung cancer. And it was a huge surprise for all of us, because for us, lung cancer was only for smokers. And my mother had never smoked a cigarette in her life, or anything else for that matter. So we started doing some research to try to understand where this could have come from. And we found out about this gas called radon, which we had never heard about before, which could be present in our home. So as my mom was going through her chemo and everything related to the lung cancer, we ordered a test in our basement, because we learned that it was, mostly in basements and indoor environments. But we did it in the middle of the summer when all the windows were nice and open, well ventilated, and the results weren't really particular. So we really couldn't explain how come my mom could have gotten lung cancer. And we decided a couple of years ago to do another test, and this time in the middle of the winter when we don't open windows as much because of the cold, obviously. And the test came back with a result of 185 BQ per cubic meters. And we didn't know what that meant. So we went online, as usual, searching. And in Canada, the maximum accepted level in homes is 200 BQ per cubic meter. So we thought, okay, so that shouldn't be it, because, it's normal. And then out of curiosity, we looked at what's the norm in the US. And in the US, it was 150 BQ per cubic meters. And in Europe at the time, it was 100, even though now it's currently 200. And the World Health Organization actually suggests a maximum of 100 BQ per cubic meter. So in our readings as well, despite all of the levels of the different countries, etc., we found out that there is no safe level of radon. So we started worrying, because my dad still lives in the home full time. We used to go there, regularly. So what did that mean for us if there's no safe level of radon? What does it mean for our families? So last year we decided to invest in a pump, I guess, that sucks out the air and removes the radon gas in order to reduce the concentration of radon in our home. And it took a few months, but slowly but surely the levels decreased, and now they're about 30 to 40 BQ per cubic meters. So we're hoping that going to have an impact, a positive impact for us. We don't know what it means for us, the fact that we lived in a home for several decades, that probably had radon at the time as well. And thought it was important to share the story so that other people could check the levels out of their place.
Great. So we, our team was recently in Toronto and we shared her story, and the silence and emotion in the room was actually very palpable because it was such a powerful story. And like I said, unfortunately, that story is not unique across Canada. And we really want to include her story because it helps bring it home a little bit. It's really hard to hear about this information and this education and really understand what it means or make it feel close to home. And I think this video really does that. And Sophia was just so well spoken in sharing her experience. So that is how our education module begins. And so just to give you a little bit of education or information on our Radon LMS, the course is designed to equip perinatal healthcare practitioners with the knowledge and skills to conduct motivational interviewing and brief intervention in assessing potential health risks and motivation for behavior change within their perinatal clients, specific to radon gas and lung cancer. All right, so for our course outcomes, as you can see on the screen, so we want our participants to gain an understanding of motivational interviewing and brief intervention techniques and their use in practice. Now, many healthcare providers or practitioners are already familiar with these concepts, whether they know it by terms or whether they naturally do it in practice. It's typically most seen in like mental health and substance use practice, but it is a really wonderful method to conduct any kind of education with patients. Secondly, we want patients to increase their knowledge about radon gas, including its prevalence in Canada, exposure pathways, health impacts, and mitigation. And again, this is specifically directed at perinatal and equity denied populations. Thirdly, participants will learn about that radon assessment tool that I introduced you to before and the brief intervention that it provides. So it helps you understand the actual brief intervention. So when people ask you questions about it, you're able to actually speak to it. Lastly, participants will be able to describe the use of the radon assessment tool and be able to use it and execute it in practice. It is our goal to have a tool designed for healthcare practitioners by healthcare practitioners and really facilitate conversations about health, minimize anxiety, and again, that translation of scientific knowledge to everyday knowledge. And as I mentioned earlier, we have designed this education to be used across multiple designations, and we have created case studies specific to doctors, nurses, midwifery, nurse practitioners, and even community health workers. And there's streamlines of case studies based on level of education and specialty that are offered within the course. But we do encourage everyone to actually cross-examine and try case studies from all the designations and really gain a well-rounded understanding of using the radon assessment tool. Next is our equity wheel. So this is also a privilege wheel, and I'm going to situate myself on this wheel as well. So I am a young, educated white woman, and for that, it does provide me a specific level of privilege. And on this equity wheel, it shows the many different levels of privilege. And what's really interesting is that our case studies, when we designed these case studies, they actually very well reflected so many varying levels of privilege that are demonstrated on this wheel, which wasn't even planned, but it really shows the kind of population that we have all across Canada. And oh, that bottom right corner, are we able to full screen that? The two arrows on the very bottom right corner. Does that help at all? Oh, it was already. All right. So as I said, these are real life case studies. And based on this privilege and equity wheel, it helps us find the appropriate time to address radon gas and lung cancer. Because despite challenges one might be facing in their life, they do have a right to essential health education. And this is where motivational interviewing and brief intervention becomes so important on deciding what information you give them and when, and their readiness to hear that. So it ensures that we're not denying people from that education because of what they may be going through, but allowing them to choose when they're ready to hear it. Next, I'm going to show you an example of one of our case studies, which is really exciting. So this is our nursing case study. And as I said, all these case studies are inspired by our real life practice and often interactions that I've had with patients. And this one here is actually close to home because this is inspired by a friend of mine, her mother, who recently passed away from cancer. So Jean is a 39-year-old Indigenous mother of 3, ages 2, 4, and 7, and she has recently received a diagnosis of lung cancer. Jean has never smoked or been exposed to secondhand smoke. She's never undergone radiation therapy, and as far as she knows, she's the first person in her family to receive this diagnosis. To arrive at this diagnosis, she had to make multiple visits to the emergency room over 2 years, where she was repeatedly discharged without her concerns being adequately addressed. After the diagnosis, Jean wondered how she could have contracted lung cancer when she's led a healthy, active lifestyle her whole life. Sitting in the waiting room of her healthcare provider, Jean notices a poster promoting the Radon assessment tool with its mention of lung cancer. This sparked her questions about her diagnosis and any potential impact on her children. Jean wonders why she's never heard of radon and why the subject had never been discussed throughout the diagnosis and treatment of her cancer. As a resident of rural New Brunswick, Jean faces the challenge of traveling over an hour to see her healthcare provider, and she is concerned with the limited amount of time to address her questions and her concerns about her children's safety. So as you can see, there's many layers to this story, and it's very representative of our population in Canada. Some don't have immediate access to a healthcare provider. Some are busy, they work full-time jobs, they have multiple children. Working in emergency, I hear so many times parents say, oh, we were going to come in a few days ago, but I had to work. Or, oh, I couldn't come in because I didn't have childcare for my other children. Or I can't have my child go through surgery because I can't stay here with them. I have 3 kids at home. So we really like to kind of encompass all those layers and really teach our healthcare providers how to address those with our motivational interviewing and brief intervention. So this is an example of one of the nursing case studies that you'll be able to work through and use your radon assessment tool after completing the education and see how you do. And as I said, there's multiple other case studies that you can try as well once you complete this one if you are a nurse. And then I just also want to talk before we give you, if we have time, I can show you our working LMS that will be launched very, very shortly. But I want to discuss what's next for us in our project. So we are establishing partners in communities across Canada with a significant number of equity-seeking families in order to provide in-person training to perinatal staff. And I believe we're choosing 3 cities across Canada. And those cities that we travel to, we will be getting 100 free radon gas testing kits that we are going to be able to distribute to the community, which is very, very exciting. So if you want to know more, absolutely reach out on our website on CANE or reach out to your radon specialist in your area, and we are happy to discuss with you or answer any questions. So I'm going to open up the floor to some questions, and then if we have time, we can show you our working learning module.
Thank you so much, Casey, for that excellent presentation and some information as well about the next steps, which are, as you said, very exciting as well too. There is a question from Vincent who had asked if I think Kelly had answered one question from Maxime, and then there was a question about whether there's an impact of home resale value when a depressurization system has been installed in a house.
Yeah, I
whether
was in the process of typing a response, but maybe everyone would like to hear. No, as long as you mitigate, you have a radon mitigation system in place, it will not impact the value of your home. Like I said earlier in my presentation, every single home has radon in it. Buy the home that you love, and test it and reduce it if it's high. And in fact, a radon mitigation system can be perceived as value add because you're improving the healthiness of your home and the quality of your air in your home.
Okay, thank you very much. And I think he just wanted to
the cost,
to repeat about the cost. Yes.
Yeah, so typically in Canada, and this is based on feedback that we get from Canadians, who are installing radon mitigation systems. So a system installed by a certified professional is typically somewhere in the range of $2,000 to $4,000.
Thanks so much, Kelly. I don't know if anybody has any other questions that they would like to answer or to say. We can
There's
let you
one more
speak.
question. I'll actually,
Sure.
Oh, yeah.
mentions,
Okay,
has
yeah.
this initiative been communicated to our First Nations communities via ISC, and do they employ CHN's community health nurses? And I'm just going to let you talk, Maxim, because I think that'll be easier.
Mm-hmm.
There, you
Hello.
can continue.
Can you hear me?
Yeah, we can. I said Maxim instead of Maxine. Sorry.
Oh, okay. Yeah, Maxine. No, thank you. Sorry, there's been some, our weather's inclement here, so there's been some issues, so I wasn't sure, but thank you. Great presentation. Yes, and I know that I really appreciated the equity wheel. And I know that especially within our First Nation communities, more importantly, as we go up north, right, it becomes even more compromising for our communities. And we do, through Indigenous Services Canada, within our First Nations, we employ, well, I shouldn't say we, but I used to work within that. I'm in another area now, but they do employ a good concentration of community health nurses who definitely could push this out. And I just wanted to ask that if that was, if there was a reach back, because this is tied, I think previously in the presentation to ISK. And a lot of our First Nation communities, of course, with the social determinants of health, housing being one of them, the housing, there's overcrowding and they're not properly ventilated and built. So that's why I was asking, because I know I will, after this presentation, I will definitely push this out to the area that I work in, but I was just wondering about that. Thank you so much.
So if you're okay with that, Casey, I'll answer that. So right now, we've developed the tools and the resources. That's the first step. And right now we're starting to reach out to partner with various communities. So Maxine, for example, if you're like, hey, this is something that I really want to work on, reach out to CANE. And then if you wanted to be actually part of that population, like that group or the healthcare center that's putting out the first kind of test, the dry run, I guess we'll call it, like the pilot testings. But like these resources are now available essentially online now. So anybody who's interested in starting to use them can start to use them pretty much as of today. If you're really interested in maybe having a little bit more support, that kind of thing, then reach out to us, and then we can even meet up with your organization and like present individually, and then do the data collection with those communities. So we're not able to share who we're going to be partnering with yet, because we need to make sure that, especially if we are going to be working with First Nations communities, we want to make sure that we have all of our ducks in a row and make sure the community's buy-in is there. And we want to make sure that the way that we have the tools adapted, and we'll be able to adapt and even adapt it specifically to their communities. So that's pretty much the next step. So as it is, you're able to share it and say, hey, this exists. Are you willing to use it? And then those 3 communities that we want to partner with for the next steps to really test out to see if like this tool and the LMS, does it actually increase testing or not, right? Because the whole goal is, because there's so little testing done in the perinatal during the transition to parenthood, this is a population that doesn't do testing. And equity denied populations are even less likely to. So we're seeing if by incorporating these things, we can actually increase those numbers. So yes, you can start sharing it. And if you want a little bit more support, you're more than welcome to message us.
I think that's a great question, though. I work quite closely with ISK, and I know ISK recognizes radon is an issue in First Nations communities, and certainly tied to housing generally. And they are trying to get funding to support radon specifically. Haven't had success as of yet, but certainly they're working with a number of communities and supporting them through testing and mitigation. So just to say, if you do want to sort of, I can reach out and see if there's an opportunity to set up a presentation with ISC on this tool for their nurses and for their environmental health officers across the country. It might be of interest to them.
Sure,
Something I
think
should
that
have
would
thought
be a
of.
great
Yeah,
idea. Yeah,
yeah.
thank you, Kelly. Yes,
And thank you, Maxine, for the suggestion.
exactly. Yeah, I think that's great. I know that there was a question from Amy about the testing, and I think you
I did
answered
answer
in the
it,
chat,
yeah.
but maybe you might want to, because she was asking about where the tests are actually done from the test kits.
Laboratories, yeah. The large majority, so radon laboratories are quite expensive to establish. How they evaluate the alpha tract detectors, which is those one-time test kits. It looks sort of like this, at least one variation of it. So the majority go to the US. That is the case. That is true. People notice that. There is a lab, SRC, out of New Brunswick, that I think New Brunswick Lung Association works quite closely with. So their kits go to New Brunswick, and there's a lab in Saskatchewan, and I'm blanking on the name of them right now. I think I just took a quick look. It is no, I went to. I can tell you. Give me 2 seconds. Yeah, environmental analytical laboratories. I think it's SRC as well. I think the one in New Brunswick is PRC, but I can provide them if you want. And there are a couple in Ontario as well, but the ones in Canada, often they are more focused on research than publicly selling test kits. But all of the kits that are listed on Take Action on Radon go to certified laboratories, and that's the most important thing, that you can trust the results that you get.
Thank you, Kelly. I think that's a really important thing to say as well, too, about that as well. We just have a few minutes left. I don't know if anybody has any other
So there was
questions.
in the chat, there's a question. I think someone had one. If you moved in and have a radon mitigation system in your home, what should you do? And Health Canada's recommendation, well, make sure the fan is running. And Health Canada's recommendation is that every 5 years after you've tested and found high levels, that you do a test just to ensure that system is continuing to work. And I'd like to make a couple comments. I thought the story that you shared with your learning module, Casey, that's the first time I think I've seen it, so it was great. A couple comments and thoughts that might come up because the levels were below the guideline, and there's differences in guidelines, and I didn't really get into it because I kept it pretty high level, our presentation, but we're very clear at communicating that there is no safe level of radon. The 200 becquerels per cubic meter is in line internationally with guideline levels that are set, but we make it very clear that ultimately it's the decision of each individual homeowner to decide, because it's not all of a sudden safe at 199. And that's why, and we know that what they tested at was in one home, and the thing is that you live often in different places throughout your lifetime. So I know of some people who've been diagnosed with radon-induced lung cancer, or they believe that's what it is, and they've gone back to their previous homes, and that's where they've found the highest level. And that's why it's important from a perinatal perspective to test and protect the young, because radon, like all radiation, its exposure is cumulative over your lifetime. So the sooner you can reduce the high exposure to higher levels, the lower the long-term risk is, because the longer you're exposed to high levels, the higher the risk. And certainly, the reality is that it's never one thing often that contributes to lung cancer, right? There's a number of things. As beyond smoking, radon is very significant, but there's also just genetics and a whole bunch of other things that play into it.
Yeah, again, those are very important points. So thank you for that, Kelly, as well. I think that was an important clarification to make as well, too, about that. I don't see any other questions in the chat or in the Q&A. I don't know if there's anything else, or if anybody has any final comments that they would like to make from our presenters before we end. for
If we have
today.
a few minutes, we can actually give a sneak peek into what our LMS looks like.
Right, okay, thank you.
So yeah, I guess for the most part, this would be the LMS. And so it's a fairly intuitive course where Casey did most of the work on this one. Actually, it was very well done. And so we have the contents and a basic description in every part of the module. And then we go into survey questions. We also actually have the video from Sophia,
Radon and
the
mice.
video that we had seen. And so if ever you'd like to re-see this this video, it's available on the course itself. But we essentially have every section separated. It's fairly intuitive, and you get to check to see how far you've gone. So it's cumulative. You can always verify the sections as well in this dropdown for the lessons. And as well, we do have the case studies down here actually. And so for the different types, or for nursing, or for excuse me, community health people, community health practitioners, we do have scenarios with the questions that follow. And so I'm not going to go too far into it because we're still kind of figuring a few things out, but for the most part, yeah, we have the tool up and running. And so yeah, I don't know if there's any questions about that.
Sylvain had a question.
Thank you so much, Fred.
Oui, merci. Thank you so much for a very interesting presentation. I'm a professor in the School of Nursing at Lakehead, and I teach a community health, population health course in the 4th year, and most of it is online because it was a clinical course, but it's a higher level learning, and I talk about planetary health, global health, and so on. And so I'm going to introduce the Radon modules right next September because I can't change my course content this year, and I find it very good. So I appreciate that you did that work. One of the things that I noticed when you were showing the modules, if you have some like questions or quizzes in it, or produce a certificate at the end, that would be a really good a motivational thing for students, because then they produce the certificate and they have proof that they've done the course. So that's just one little thing I wanted to add. Also, I'm so interested that I want to join your Canadian Association for Nurses for the Environment. And I'm trying to do the thing online, but I could probably talk with who's your rep there, because I was trying to fill
In
it out.
Ontario, it's Steve.
It's Steve.
So if you go in, that'll be good. So one of the things
but
as well, if you do teach in 4th year, I'm actually going to show you, because I know it has nothing to do with radon per se, but I'm going to share my screen right now. So you can just go to the website, message our member number, and please stop the recording now, Fiona.
So maybe I'll just say if anybody has any final comments that they would like to make, or any questions. And then otherwise, I'm going to thank everybody for all the attendees who were able to attend in person today, and those who will be listening to the recording subsequently as well too. And thank you very much for all our presenters. And thank you for Health Canada, Kelly Bush, and for Health Canada for this wonderful collaboration that we've had in producing these initiatives as well too. It's really important for our organization, and I hope that it really is going to help people be aware of this topic that so many people still are not aware of, and what we've seen today, the very significant health risks that are associated with radon. So thank you very much for that. And just to again remind people that they can certainly contact us through the website. I think those who registered for the webinar today had an email that they can link to as well too to get more information. But we also have a contact information through the CANE website as well too. And so we would certainly welcome any questions, any comments, any follow-up. If anybody starts to use this tool, we would be very happy to hear as well too about their experience with it. So thank you very much to everybody, and wishing everybody an excellent rest of day.